Hello friends, welcome back to my channel Dental Minibytes, Basics to Mastery about all dentistry related educational videos. So, so today topic is on facial muscles. We are going to divide this facial muscles into part 1 and part 2 as there are many facial muscles. So we are going to see about its origin, insertion and what is the action of each and every muscle and also the nerve supply. So we'll move on to the topic. The first muscle is occipitofrontalis. In occipitofrontalis, it has two belly. One is occipital belly, that is, this is occipital belly, and this one is a frontal belly. The occipital belly, it has origin from its superior nuchal line, that is, lateral two-thirds of the superior nuchal line on both sides, and from the mastoid process. This is mastoid process of the temporal bone. So this point of origin has two things. And frontal belly, it is from the gallia aponeurotica. So both occipital belly and frontal belly, they insert into the gallia aponeurotica, and this insertion of frontal belly in the fascia of the facial muscles. The action of the occipital belly is it draws the scalp backside, and also it aids the frontal belly to cause wrinkling in the forehead. The action of frontal belly is it draws back the scalp, and also it causes wrinkles in the forehead and raises the eyebrows. Occipital belly is supplied by both are supplied by the facial nerve, but occipital belly is through posterior auricular branch and frontal belly is through the temporal branch of facial nerve. So this is about occipitofrontalis. And the next muscle is auricularis muscle. It has three parts: auricularis anterior, auricularis posterior, and auricularis superior. It has origin from the fascia in the temporal region, and posterior from the mastoid area of the, this is the mastoid process, mastoid area of the temporal bone, and auricularis superior is also from the fascia in the temporal region. So the anterior, as its name suggests, that it inserts anterior to the helix of the ear, and this is posterior to the ear, and this is superior to the ear. As it is superiorly present, the auricularis superior, it draws the ear upward while movement during the scalp, and it draws the ear forward, and posterior draws it backward and upward in some individuals. Auricularis anterior, this anterior and superior, is supplied by temporal branch of facial nerve, because this both muscle is attached to the temporal fascia, but auricularis posterior is situated posteriorly, so it is supplied by the posterior auricular branch of facial nerve. The next muscle is important muscle, which is orbicularis oculi, the eye muscle. It has three parts: orbital part, palpebral part, and lacrimal part. The orbital part, it originates from the frontal bone and maxilla. This is the orbital part, and it continues around the orbit and return to its origin. This is the orbital part. And lacrimal part, this one is lacrimal part. It originates from the lacrimal bone. This is the lacrimal bone, and inserts into the lateral palpebrae raphe. It originates from the lacrimal bone and inserts into the lateral palpebral raphe. And palpebral part, this one is a palpebral part. Medial palpebral ligament, it originates from here, medial palpebral ligament, and inserts into the lateral palpebral ligament, which is present in the zygomatic bone. The center part is the palpebral part. So the action of the orbital part is strong closure of eyelids as it surrounds the eyelid, and the action of lacrimal part is it draws the lacrimal canal onto the surface of the eye, and the action of the palpebral part is gentle closure. Heavy closure is about done by orbital part, and gentle closure is by palpebral part. Then the nerve supply for this muscle is temporal and zygomatic branch of facial nerve for three parts. Next, the muscle is levator palpebrae superioris. It has its origin from the sphenoid bone, that is lesser wing of sphenoid bone. Here it originates and gets inserted into the skin of the upper eyelid. So the main action is, as its name suggests, levator palpebrae. So it elevates or raises the upper eyelid. The nerve supply is by oculomotor nerve, which is the third cranial nerve. Then corrugator superciliary, it originates from the medial end of the superciliary arch and it gets inserted into the medial portion of the eyebrows. Here the origin is here, superciliary arch, and inserted into the medial portion of the eyebrows. It draws the eyebrows downward. As it gets inserted medially, it draws the eyebrows downward and medially, and it is supplied by the temporal branch of facial nerve. Then the next muscle is procerus. It originates fascia over the nasal bone and lateral nasal cartilage and skin between the eyebrows. It gets inserted. Origin from the nasal bone here and gets inserted into the skin between the eyebrows. So it draws the eyebrows down and causes wrinkles the nose. So the nerve supply is buccal branch of facial nerve. Then the next muscle is nasalis muscle. It has two parts. One is transverse part. This is the transverse part. And the second one is the alar part. The transverse part, middle of the maxilla, traverses the nasal bone and inserted into the muscles of the opposite side. And the alar part is, it has its origin from the alar cartilage skin on the nose and gets inserted to the skin at the point of nose, and it merges with this transverse part. The action of this alar part is both transverse and alar part. It opens the external nares during forceful inspiration, and it is supplied by the buccal branch of facial nerve. Then the next muscle is depressor septi. Depressor septi, it has its origin from the incisive fossa. Here is the muscle, incisive fossa of the maxilla, and insert into the nasal septum and ala of the nose. Here it gets inserted in this area and origin from the in this area, incisive fossa of maxilla, causes constriction of nasal airway, and the nerve supply for this is buccal branch of facial nerve. Then orbicularis oris, the only muscle which surrounds the mouth. It has a lateral band which is originate from the alveolar border of maxilla and has a medial band which originates from the septum of nose and inferior portion lateral to the midline of the mandible. It gets inserted into the angle of the mouth. It encircles the mouth and gets inserted into the angle of the mouth on both sides. So the action is closure and protrusion of lips, supplied by buccal branch and also the mandibular branch, because the inferior portion is supplied by the mandibular branch and the lateral and medial band is supplied by the buccal branch of facial nerve. So this is about muscles of face. So we'll see the part 2 video. Thank you.